Hello, I'm Donna Cryer, CEO and founder of the Global Liver Institute. I'm very proud today to be able to bring you our liver cancer lessons, part of our educational series on liver cancer with experts from across the country and across the world. Today, I have the honor of bringing to you Dr. Richard Kim, who is Section Chief of GI Medical Oncology at Moffitt Cancer Center. Today we'll be talking about treatments for liver cancer, specifically or primarily hepatocellular carcinoma. We are honored to have Dr. Kim as a member of our Global Liver Institute Liver Cancers Council. Hello, Dr. Kim.
Hello. Thank you very much for inviting me, Donna.
Thank you so much for speaking with us today. So please, let's start with, how are patients typically diagnosed with liver cancer?
Sure. So as a medical oncologist, the patients that we see in our clinic are typically diagnosed with liver cancer when they present with some form of symptoms, such as abdominal pain, they are jaundiced, they turn yellow, they have itchy skin, or weight loss are the most common symptoms. And usually when they present with those symptoms, sometimes the workup gets done, including a CAT scan, which happens to find a lesion in the liver, and the outside doc may biopsy those liver lesions, then they are diagnosed with hepatocellular carcinoma. On the other hand, there are other types of patients where they have risk factors for developing liver cancer. For example, hepatitis B, hepatitis C, they have chronic problem with drinking. Now, those patients are followed much more closely by their gastroenterologist, and they go under a process of screening and surveillance. And in those cases, those patients could also have early diagnosis of HCC as well, where they get treated accordingly. So there are many ways that patients do typically present. However, at least in my clinic, in medical oncology clinic, they present with some form of symptoms that leads up to workup, and with that ends up with a tissue diagnosis of hepatocellular carcinoma.
Should every patient with a diagnosed liver disease, whether it's viral hepatitis or NASH, be screened for liver cancer? And if so, what does that screening look like, and how often should it be?
Sure. So this was done by my counterparts, hepatologists, which I'm not, but I work very closely with them. So there are definitely certain risk factors that puts them at high risk for developing HCC. For example, hepatitis B, hepatitis C. And if the patient has a risk factor for developing what we call a NASH, or non-alcoholic steatohepatitis, or fatty liver, or if they have a, once again, long history of ethanol abuse, those patients are followed closely by gastroenterologists. And depending on the risk factors, they do undergo lab testing along with ultrasound, and some in cases imaging with CT scan. And by going under close surveillance in those patients, we're able to pick up those cancer at an early stage, where where the patient could potentially be curable with either liver surgery or possibly transplant. But obviously, that's something that's followed very closely by my counterparts, hepatologists that I work with closely.
Is there a particular blood test? I know that, as a liver transplant recipient, I'm very familiar with all my liver function tests, liver enzymes. When we start talking about liver cancer, it's the first time that I heard about an alpha-fetoprotein, or AFP test. Is that part of liver cancer screening?
Yes, I think it is. Well, I think it is part of it. The issue with alpha-fetoprotein is that sometimes it's not. It's about 20 to 30% of the time the patient with liver cancer do not produce that proteins. So I think you will see patients with a very advanced liver cancer with a normal alpha-fetoprotein. Definitely, as a screening process, I think my counterparts do use it. Definitely, once you have advanced disease, that's something we follow along with the imaging to see if the patient's responding to the treatment or not.
So, Dr. Kim, you mentioned many patients with advanced disease. This may differ based on what country people are in, or what area of the United States they're in. But typically, at what stage are liver cancer patients diagnosed? I've heard it's often very late.
Yes, it is. Unfortunately, only way to cure the HCC is either a liver transplant or a liver surgery. Now, problem with the liver surgery is that a lot of patients have sick liver from liver cirrhosis, therefore are not a candidate for a liver surgery. And the transplant, obviously, you need a donor of liver to be available. So unfortunately, that probably, liver resection is probably possible, maybe 20%, and liver transplant, you may add additional 10 to 15% depending on the region you live in. Therefore, unfortunately, most of the patients who are not a candidate for those two will most likely present at a more of an advanced stage. And as a medical oncologist, those are the patients that I see the most. Unfortunately, are not a candidate for surgery or transplant because they present at an advanced stage where really sometimes option becomes either a local therapy or some form a systemic therapy to help control the cancer.
Dr. Kim, can you describe the different stages of liver cancer that you might discuss when you're diagnosing a patient?
Sure. So in liver cancer, actually, there are many staging criteria that we use. Now, this is something different than other cancers. Most common staging system we use is a TNM staging that is used in other cancer. Now, TNM stages is basically taking in incorporation of the primary tumor site, the number of lymph nodes, and whether they have metastatic disease or not. So it's typically stage 1, 2, 3, and 4. The problem in liver cancer is that if you say you have stage 2 colon cancer, most people think it's a good thing because it's not stage 4. In liver cancer, it's sort of irrelevant because it could be stage 2, stage 1. However, if you're not a candidate for a transplant or liver surgery, it really doesn't matter because the treatment will be more of a palliative intent. Okay, so the staging could be very misleading in liver cancer. The other thing that we commonly use is a Barcelona clinic liver cancer system. That's another staging system. The big difference between that and TNM staging is that this BCLC, or the Barcelona cancer staging system, incorporates not only the number of the nodes, for example, or size of the tumor, but it also incorporates underlying liver function and also underlying performance status. And based on that, there's a guideline in terms of how we manage those patients. However, for the sake of the patient, I think the staging is a little bit irrelevant in most of the cases because, once again, I think liver cancer, either you are resectable or you're only curable by either resection or a transplant, or you're not. I think those are the two big things that we lead to. But however, the staging systems, what we use as clinically when you see the patient, but to the patient, it may be a little bit less relevant because it may actually give you some misinformation on your actual prognosis, for example.
Dr. Kim, thank you so much for discussing how patients are diagnosed with liver cancer and what those early conversations characterizing their stage of disease looks like. I look forward to talking with you in more liver cancer lessons.